We'd like to extend a warm welcome to the three panelists joining us, all with unique roles and perspectives, which we are excited to discuss. We will just briefly introduce you before proceeding. With us, we have Dr. Dottie Comer, board certified in psychiatry and neurology, and an assistant professor of clinical psychiatry who supervises medical residents in Prevention and Recovery Center for Early Psychosis and teaches part of the resident curriculum for psychotic disorders. Dr. Comer is interested in promotion of effective service delivery models and psychosocial treatments for serious mental illness, along with pharmacological treatments. Last year, Dr. Comer completed a clinical fellowship in public psychiatry. She is currently studying in an implementation service certificate program in the Midwest, as she is interested in using implementation science as a tool to help bridge the gap between the evidence-based knowledge and actual medical practice. We also have with us Ms. Anita Cameron, a New York State licensed social worker who provides psychotherapy in a private group practice. She primarily sees adolescents and young adults, takes an eclectic, empathic, client-centered approach, integrating support, skills, and exploration based on each client's needs. In addition to traditional face-to-face therapy, Ms. Cameron regularly provides phone, Skype, and FaceTime therapy sessions to clients who are away at college who are otherwise unable to attend in-person sessions. We are also very fortunate to have the valuable input of mental health consumer Ms. Farah Wahir, a young professional female who received psychotherapy during college. She has strongly considered the possibility of starting to receive therapy again, believes it could make a significant difference for her difficulties with anxiety, and has looked into options available. At present, however, a busy schedule and many other responsibilities have created pragmatic barriers to receiving this needed mental health care. With this in mind, Farah holds the perspective that clinical services provided online may change the nature of the therapeutic interaction, but at the same time may still be of great value as an alternative to being completely unable to logistically arrange in-person sessions. Thank you all so much for joining us, and we look forward to hearing your thoughts.
Thank you.
So with that said, I'd like to begin just by asking if you can share a bit about your overall impression of telepsychiatry and your exposure to this issue within the context of your involvement in the field of mental health.
Sure, I can speak a little bit about that. I just want to give a disclaimer, just briefly, that I don't have direct experience using telepsychiatry myself in this direct modality, though many of my colleagues are very involved in its usage and in its development, including the development of one of the first programs designed for its use. And especially now, as I'm in the Midwest, in a certificate program for implementation science, many of these up-and-coming modalities are really very frequently considered. So.
Well, I can say, as a clinician, I work a lot with adolescents in an outpatient setting. So I have found that telepsychiatry and online therapy in general has been very helpful when logistical barriers are in place, especially during times of transition and when access to face-to-face therapy might not be feasible. A lot of my clients are going through big transitions, significant events, and going off to college. And during these times, they tend to be more vulnerable, and there tend to be more emotional challenges that arise. Even like being away on vacation with family members when they really need someone to talk to and can't come into the office. So the use of online sessions allows for greater stability in the therapeutic relationship, and it provides an easier transition and continuous support once a rapport has been established, or before other more local sources of support have been found if they are relocating to a new location or going off to college.
Like was previously mentioned when you introduced us, I got therapy back when I was in college, and I would really like to start receiving services again. But I really have a crazy schedule, and it's really hard to find a time that works for both myself and the therapist. So I'm really excited about this option, because I feel like it could really make therapy a possibility for me again. I would like to meet in person first, just to establish whether or not there's a connection between the therapist and myself. And then going forward, it would be really helpful to meet online.
Great, thank you. So with this range of experiences and contexts, I'm wondering if there are any concerns about telepsychiatry that seem to be particularly significant, either from your own perspective or from perspectives of those you've engaged with.
Yeah, well, I can say one thing I've heard from many colleagues and others is they appreciate the convenience of telepsychiatry, but I mean, it's not necessarily something they would feel comfortable doing from their own homes. And it's not just because of privacy, it's also that many feel that there are risks associated, and just the same risks with any psychiatric practice. If, in particular, for example, there are concerns around a client's safety, they would prefer to be in an office setting and really know that if a client all of a sudden is presenting in a way that is indicative of perhaps a safety issue, that they have the resources available and other colleagues or clinicians around to provide the necessary support and really take action as is necessary.
Yeah, similar to what Dr. Palmer said, I agree with everything she said above. Coming from the perspective of a therapist who has done these type of services with clients, I definitely wouldn't feel comfortable relying exclusively on online sessions from the very beginning. I think it's really important at first to meet with the person face to face at least once or twice and do a full intake, build rapport, and assess their level of risk, really understand what their baseline levels are. And then to make sure that online therapy is a feasible option for them. I wouldn't say that there's necessarily a set of diagnoses that either are or not appropriate for online therapy, but I think that everyone's different, has different needs, and there are different reasons people come into treatment. So I think it would kind of have to be assessed on a case-by-case basis whether this would be a helpful option for some, and I think it will be helpful more for some and not for others.
And personally, I can say that I would only want to do therapy after first meeting with the therapist in person. But then I wouldn't mind continuing online if there was a connection between us and I felt comfortable. But I definitely think that it's important to meet in person first to see if we click. There are some things that you just can't really read through the internet that you can read when you're in person with that person, whether or not you feel safe.
So in addition, given all the discussion we often hear about privacy in healthcare settings, what are your thoughts on whether confidentiality seems to be a concern in telepsychiatry at this point?
Well, this is definitely something that comes up a lot, and there are strict regulations in place at this point, as you may have seen actually on the official American Telemedicine Association website, where it's outlined to show the regulations as they vary quite a bit from state to state. And they do a really good job of outlining those there. And at the same time, this is something that I've heard a lot about, mostly in the context of clinicians wanting to make sure, understandably so, that they are, adhering to these regulations, and especially with this kind of specialty, to comply with the set standards. So even though one of the reasons that this was developed was to really deal with the access for individuals in more rural areas. I know that there are, in particular, a couple of states, I believe Massachusetts is one of them, where there are stricter regulations about doing interstate contact or online therapy. And I know one of my colleagues also who developed this as a service available in a state hospital in New York, really had to check on all of these issues and look into the technical consultation aspects, specifically to look at settings up for confidentiality and the specific programs used, things like online settings, connections, file type, and the kinds of protection, password issues, things like that.
The issue of confidentiality in medical settings in general is a very hot topic right now. The use of HIPAA forms and the talk about HIPAA for every kind of care has made everyone really aware that confidentiality is something that every patient in a healthcare setting has a right to. At the same time, I'm not really sure that the risks associated with online therapy are significantly greater than face-to-face meetings. I can see why there would be a concern, though, especially if the person hasn't worked with that therapist before, although none of my clients have raised the concern. However, I do know that there are clearly stated regulations about the types of software programs that can be used in accordance with HIPAA, and I make that very clear to all my clients in the beginning, especially since I do work primarily with adolescents. The majority of them want to meet over FaceTime for our online appointments, which is not the type of software generally discussed in these regulations. So, I tell them that I'm respecting their privacy and I won't be disclosing their session in any way, except for the usual safety concerns if, they're at risk of harming themselves or others. But they that they need to know that even though I'm willing to do this, it's not officially a HIPAA approved modality using FaceTime, but I still do it with them if that's what they want.
Yeah, and like you said, like many of your clients, I also, it hasn't been a major concern for me, not any more than a face-to-face session would be. But that being said, I do expect that my privacy is respected, but I guess there is no way I can really guarantee that, and I kind of feel the same way for a face-to-face session. There's no way I can absolutely guarantee that is being respected.
With these regulations in mind and the awareness that New York State now allows telepsychiatry as a Medicaid billable service, what do you anticipate for telepsychiatry in the near future? Will this potentially encourage its spread? Will it affect availability of service? Increase willingness to communicate with clients in this way?
Interesting. Well, I think the greater use of technology, and it's really the direction we're moving in generally, and so this works with that pattern. And I do think that it's important to recognize that while it may increase access for those not in close proximity to clinical services, it still does leave a workforce problem. And by that I mean that, after my time in a fellowship with public psychiatry, I've really seen and increased my awareness that there is a big shortage of psychiatrists who are really wanting to work with any kind of high risk or what's often referred to as treatment resistant kinds of populations. And so, there are many complicated cases out there, and there are also many psychiatrists who are very unhappy with reimbursement rates. And so there's a shortage out there, and providing the online services still requires, this issue of supply and demand. It still requires that we have enough clinicians to meet the needs of the number of clients. And so the caseloads are not decreasing here, they're increasing, and that doesn't add to availability of existing clinicians. If anything, we will have more people accessing services, and we don't exactly have people flocking to the field, so it really, in a sense, decreases availability, and that is a concern.
It's definitely true, Dr. Comer. Overall, I think it's becoming and will continue to become a really important and more widely accepted option for providing treatment. I think it will also slowly become less of an approach that is more skewed towards the younger populations, those who may be considered a little bit more tech savvy. And as older generations continue to become more infused with technology and familiar with its uses, in the ways it's kind of increasing across all platforms, not just healthcare, they will kind of begin to jump on the bandwagon as well.
I definitely agree with that. Even some of my job interviews now have been held online. And while it is a little nerve-wracking, you get nervous whether or not your technology is going to work, it does make things easier. So there is a convenience factor there. And I think that overall technology is giving me more opportunities, and I'm really hoping that I can get engaged in therapy again, and that this will help me do that given my busy schedule.
Well, it does look like we're just about out of time, but thank you so much for your input, and we truly appreciate being able to hear from all of you and learn more about this interesting practice. Thank you once again.
Thank you.
Thank you.
Thank you.